Dr. McNasty, Triborough GI here again. And today we're going to go through the colonoscopy procedure. It's a very important procedure that we do for a multitude of reasons, some of which are just colorectal cancer screening, checking to make sure people have polyps that predispose them to colon cancer. And sometimes the procedure is not screening, it's diagnostic if people are having problems. We did the upper endoscopy procedure before. This was a little bit different. Obviously, it requires some preparation. And while we do this procedure, as you'll see, we are going to closely inspect the mucosa or the lining of the intestines as we go. And actually, it's not so much as we go. I should clarify it. Really, the first portion of the colonoscopy is getting to the end of the colon. This is where the gastroenterologist basically navigates the colon through to the very end, as signified by getting to the cecum, as we call it. So here we actually have a polyp. We're going to remove it right away. We don't want to lose it. So this is exactly why we do this procedure, right? So we see polyps, we remove them. So some polyps predispose you to get colorectal cancer. We don't want that. Open. Close. And there it goes. That polyp is gone. And that's not going to be a problem anymore. So you might see a little bleeding. That's okay. That stops pretty quickly. As you can see, it's already over. And on we go. So we'll put that down as descending colon. Yeah, descending colon polyp. Okay. So as we were talking before, colonoscopy requires a preparation. Usually the day before you have to be on a liquid diet, and you take some laxatives that your doctor prescribes for you in order to clean the colon out and prepare it for the colonoscopy procedure. In order to have it done, you have to have a clean colon, because usually you have stool in the colon. That we don't want to look at. We want to make sure just looking at the lining of the colon. The first portion of the colonoscopy is called the insertion, and we're really just trying to get to the end of the colon. The majority of the actual inspection and looking for abnormalities like polyps that we saw just a few minutes ago actually is done on the way out. So it's actually done on the, as we call it, the withdrawal portion. When we withdraw the camera, when we withdraw the instrument, and we inspect the mucosa as we go along. So in the case that, let's say, if we see something that's abnormal on the way in, if this is not too big, what we'll do is we'll actually just remove it right then and there. Typically, the colonoscopy procedure is maybe 15-20 minutes or so, depending on what needs to be done. Fairly well tolerated. Most people don't have any major symptoms. Sometimes you can have a little cramping in the colon, a little gassiness. That's normal because as I'm actually going through the colon, I'm inflating air to actually be able to see. So it's normal. The colon doesn't really like air. So it's normal to have a little bit of discomfort after colonoscopy, and that usually passes within a very short amount of time. A lot of colonoscopy is just suctioning up just liquid contents in the colon, and also suctioning up the air and helping to propel the instrument forward with the help of suction by basically shortening the length of the colon and pleating the colon on the instrument. That's sort of like the technical term that I use. Here you can tell we're actually in the transverse colon, which is somewhere in the middle of the procedure, or the middle of the colon rather. You can tell by the triangular folds in the actual colon. Here we are, we're actually at the end of the colon. This is signified by this structure over here. It's called this appendiceal orifice, or where the appendix actually exits. You can actually see it looks like a half moon. Okay, and that signifies the end of the colonoscopy, meaning we've reached our destination where we need to start inspecting. So now we actually begin the part where we inspect the colon for any abnormalities and polyps and stuff like that. So we'll take some photographic evidence on our way out, some pictures, just to show we were here and everything looks good. So as you see, I'm slowly and carefully withdrawing the instrument, and I'm carefully examining the walls of the colon and looking for any other polyps or anything. We already did find one. On the instrument I have a water jet, so I can actually clean up some surfaces, which is very helpful in identifying small polyps if necessary. withdrawing the instrument, taking pictures.